Dr. Vijay Bhaskar, Chairman, Ethics Committee, Clinical Research and Trials, Masters in Orthopedics. Most of the people undergo knee replacements and knee surgery since after the age of 45 to 70 because of there is a wear and tear in the knee joint leads to degenerative osteoarthritis, leads to the pain in the knee joints and the deformity in the knee joints like knee swelling and unable to walk, climb the step, sit down, get up, use Indian toilet or anything else. So obviously such people, when there is a proper indication for surgery like total knee replacement, there won't be any problem. Unless until the proper indication for surgery is not done, then post-operatively the patient might get certain problems. So earlier we must, before surgery, see that the patient other clinical conditions like vitamin D deficiency, calcium deficiency, BMD tests, and as well the general condition of the patient and physiotherapy for the knee to strengthen the muscles and ligaments are most important before the going to do the surgery. And then a proper surgical procedure where you balance the collateral ligaments, you maintain the biomechanical axis of the knee replacement and properly fixation of the implants with the cement and proper caring of the soft tissue and proper closure of the knee surgery. In that matter, what exactly happens, either of it, these you don't take care, then there will be a lot of complications. Such complications are treatable, but the patient suffering is painful. Hence, I request my dear friends, the indication for the knee replacement surgery obviously must be grade 3 to grade 4 damage to the knee. I mean to say there is a gross wear and tear of knee cartilage and knee bone ends, and there is a gross deformity of the knee that is called genu varum, and there is a lot of osteophytes at the edge of the bone joints, and there is shifting of the axis of the loading joint, and there is obviously the pain is not subsided with any medicines, physician or any physiotherapy or any brace, and total damage to the joint line or joint space is the indication for the surgery. Apart from that, we must see that the general condition is good, vitamin D, calcium levels are good, BMD test is within the normal limits, and see that the knee joint muscles and ligaments are powerful. After that, if you do a total knee replacement, the recovery will be better. Soon after the surgery, you must know to understand that you should do regular physiotherapy, which are important to recovery. Apart from recovery, we must give a proper medication, antibiotic therapy, else while the recovery will be obviously good.